Hello everyone, welcome back to Medicine Synopsis. This is the IBQ series image based quick revision where we simplify the most high yield images for NEET PG, INI-CET, and FMGE. Today's topic is Vortex Keratopathy, an image you just can't afford to miss in exams. Let's begin with this classical slit lamp image. Can you see the world-like golden brown lines on the cornea? This is the hallmark of today's topic, vortex keratopathy, also known as corneal verticillata. It is a world-like golden brown or gray opacities deposited in the corneal epithelium, radiating from the center outward like a whirlpool. In corneal verticillata, these deposits occur because certain drugs or metabolic products accumulate in the basal epithelial cells of cornea, aligning with the natural migration pattern of epithelial cells, hence the whirl or vortex pattern. Now let's know about the causes. Remember the mnemonic FAAB CLIP. Fabry's disease is the most common systemic cause which is usually associated with a triad of features, that is angiokeratomas, neuropathy, renal involvement. Amiodarone is the most common drug-induced antimalarials which include chloroquine, hydrochloroquine, bisphosphonate, chlorpromazine, latanoprost, indomethacin or ibuprofen, phenothiazines. Patients are usually asymptomatic and is often picked up on routine ocular examination. Vision is usually not affected. On slit lamp, we see the classic whirl-like opacities. In Fabry's, it is associated with angiokeratomas, neuropathy, renal, and cardiac disease. Prognosis and management depends on the underlying cause. If it is drug-induced, changes are reversible on stopping the drug. If secondary to Fabry's, deposits persist, but the treatment is aimed at systemic enzyme replacement. Important point to remember is this is usually not a sight-threatening condition. Let's solve a case-based MCQ on this topic. A 55-year-old man with a history of atrial fibrillation is on long-term medication. He presents for a routine eye checkup. On slit lamp examination, the ophthalmologist notes golden brown whirl-like opacities in the corneal epithelium radiating from the center in the vortex pattern. Vision is normal. The most likely cause of this finding is options include Fabry's disease, amiodarone therapy, hydrochloroquine toxicity, and try to guess before I reveal the answer. The correct answer is amiodarone therapy because in the question they have mentioned the history of atrial fibrillation and the patient is on long-term medication which is amiodarone. Amiodarone deposits in the basal epithelial cells of the cornea, creating a characteristic whirl or vortex pattern. Importantly, this finding is reversible if the drug is stopped. Thanks for watching Medicine Synopsis. That was today's quick revision. Don't forget to subscribe for more high yield examples. See you in the next topic.